but the general feeling is that we want everybody to feel free to talk, ask questions, and get the information that you need, and not everyone likes to be recorded. So we do record it, but it is for our records. We use all the information from that we share, but also that you ask about, to make sure that our resources that we put out after this session are contain everything that you need and everything that you asked about. Okay, I'm gonna come on camera here for a moment and talk with you and just say hello. My name is Pam Valvano, and hopefully you can see me. I'm kind of at an odd angle here. But say hello. I am the contract manager for the CES and SLS work, and I am going to be talking with you today about the CES portion of our presentation. Okay, so glad you're all here. And I'm going to move on with some of our housekeeping here. I see some more people joined us, so let me just say once again, if you have not registered, please put your name and organization in the chat. If you have registered, we know you're here, so you don't have to do that. And again, this is for CES and SLS. This is not for the skilled nurse assessor. Today we're covering the CES waiver application and the supported living services exceptions process, and presenting information on those. I'm going to ask all of you to please keep yourself muted today, and use the chat to ask questions, or when we get to questions, we'll have question opportunities at the end of each of the presentations. You can come off mute and ask your question. We'll pick up the questions in the chat, but if you could stay muted during the presentation, then everybody will be able to hear what we're saying. So we appreciate that. We are recording, and we will use that recording to make sure we have the resources and answers to all of your questions. Also, a reminder, I'm going to chat in our support center information. This is for the work under this new contract that started on July 1st. For those of you who have been around prior to that and worked with us on our previous contract, the phone number and email address is the same. But if you need support, particularly with Qualitrack, accessing Qualitrack, resetting your password, you can call or email the Telligen Support Center. Okay, I also have other resources that I'm going to paste into the chat for you as we talk about them. So watch for that. And just one more reminder, we're going to take questions at the end of each presentation. Okay, so here we go. We're going to get started. To start us off today, I'm going to call on Karina Barrick from the Department of Healthcare Policy and Financing. She's going to introduce the team members from the department that are here with us today. Karina?
Thanks, Pam. Good morning, everyone. I'm Karina Barrick. My pronouns are she, her, hers, and I'm with HCBS. I will be here today to help provide support and answer any questions on SLS exceptions. And I'm joined by my colleagues, Erin Munoz and Kidron Bacchus, who will help provide support with CES applications. Our contract manager, Nushin Burgess, isn't joining us today, but in her stead, we have Elizabeth Riechers Medina, who is joining us if there are any contractual questions. Thanks, Pam. Pass it back to you.
Thanks, Karina. I'm going to quickly introduce our team members who are here today. April Kelly will be presenting to you on SLS today. She is an SLS reviewer. You may have known her from her brain injury work. She leads our brain injury assessment and also previously worked on HMA, as did most of our other reviewers. I'll be talking to you about CES, as I said before. We also have the rest of our review team, Joy, Susie, Jasmine, and Cassie, who do reviews for these reviews when they can. Our nurses do CES, and we have both nurses and non-nurses doing SLS. They also work on other reviews and assessments. And then we have Kristen, our star administrative support. She's wonderful. So we appreciate her being here to support us today through this session. So welcome, everybody. That's who's here, along with all of you. Today, our goal is to increase your understanding of the information and documentation needed for CES and SLS reviews. And for CES, we're going to cover how we complete the application, details on the medical condition and behavior portion of the application, details on the interventions. I know that's what you want about CES today. We're going to cover RFIs and how to avoid them, and anything else having to do with outcomes or any questions you have. On the SLS side, we're going to cover the SPAL and budget. We're going to cover standard and urgent requests, how to complete the application, submitting the application, when, how often, and what's required, and any resources involved for SLS for you. All right. Once again, final reminders, because I've seen more people join in. As you see me looking over here and you see the side of my face, I'm looking to see if people are joining, and they still are. So thank you for being here. Please keep yourself on mute while we're doing the presentation, and then we'll have time for questions at the end of each topic. You can save your questions for the end, or you can chat them in, and we will get to them and try to answer all of them today. Okay, thank you. Let's move on. So I'm going to go ahead and turn off my camera here because the side of my face isn't that interesting, nor are my boxes. So I'm going to just turn that off so that you can see the slides and see what we're talking about as I'm reading this for you. Case managers, please be sure that as you are working on the CES application, you are using the most recent version, which says on it, revised February 2020. That is the most recent version. And if it says something else, there's a previous version that we see occasionally being submitted, and that one's from 2019. If we get the older version, we're going to RFI you and send you a request for information and ask you to use the newer application because there were changes made to it for that revision in 2020. So please just make a point of doing that if you could. We appreciate it. For the CES application, we ask the case managers to work with the family to help complete it. Can be a daunting thing for the family to look at this application and understand the language, understand how it works. And we're hoping today that we can equip you with more information and ability to help get that from the family, and you can work closely with them to complete the application, make sure that everything that's needed is on there. We want to make sure that what we're seeing in the application also is going along with what's in the level of care assessment, currently the 100.2, and that all of this information reflects the member's current diagnoses, condition, all their circumstances, and all their needs. We also want to ask you to include any other documentation that would be helpful to the reviewer, such as medical records. These additional documents are not required, but if available, it could avoid an RFI and help speed up the review if you can provide them. You would need to, of course, get some of that from the family, but it does help us a lot. It helps us understand the member's situation. So when you're doing the application, the information on the conditions or the behavior in the medical condition go beyond what is typically age appropriate. I want you just, if you would, while I'm talking, look at this slide and what's there in the language. I snipped the top of the application to just bring your attention to what it says there. So we're looking for the information on the conditions that do make the behavior or medical condition beyond what is typically age appropriate. We do have age appropriate guidelines that we use. We want to see if there's a significant pattern of serious aggressive behavior towards self or others or property. We want to see if there are constant vocalizations such as screaming, crying, laughing, or verbal threats, which cause emotional distress to caregivers. And all of the above is evidenced by parent statement or data. And that includes that the child's behavior or medical needs have been demonstrated, or that it can be established that in the absence of existing intervention or prevention, the intensity and frequency of the behavior or medical condition would resume to a level that it would meet the criteria listed above that I just mentioned. All of this, I read that to you because all of that is taken directly from the application, from the regulation. So it helps you as a reference as to what we're looking for here. And just be sure to review when you do an application, especially depending on how often you do them. The top of the application has really great information about the application, about what's needed, about the targeting criteria that Telligen is looking at for this. So be sure and look at that. Understand that interventions that require direct human intervention, behaviors and medical conditions that require direct human intervention need to be more intense than a verbal reminder, redirection, or a brief observation of medical status. Um, Also note that the timing of the interventions is listed as at least one every 2 hours during the day and a weekly average of once every 3 hours during the night. And that verbiage is specifically on the application, and it's a reminder as to how people qualify for the CES waiver. The CES waiver is intended to be for the children with the highest, most needs, most impacted, and that is part of how this application is evaluated in terms of when those medical conditions or behaviors occur, and the interventions that are done to assist the care that the caregiver is doing. Please be sure and provide accurate information about all the medical conditions and behaviors or the vocalizations of the child. That includes basically 3 categories, and you're going to hear this multiple times today because it applies in every situation. We need a description. That description should be a complete description. It doesn't have to be a long narrative, but it has to contain everything that's needed to understand what the medical condition or behavior is. It can be a couple of sentences as long as it's clear and describes the child's needs, circumstances, condition, what's happening during this behavior or when the medical condition requires attention. We also need the frequency, which is how often this particular medical condition or behavior occurs. We need that during the daytime and during the nighttime. And we need the duration, how long it typically lasts. We know that sometimes it can be a challenge to quantify those things, the frequency and duration in particular. But if uh, if you help the parent get to that, it can be the most valuable thing to us in this review, and we will hopefully avoid RFIs by getting that information. The same information is needed for each intervention. We're going to talk about that in detail in a few minutes, but just keep that in mind. We need a description of the intervention. We need the frequency, how often it happens, and we need the duration, how long it lasts, and that can be on average. Understanding that we're all humans and timing of things and how often they occur can range. So we're looking for an on average number of how long things last, interventions or behaviors, and how often they occur. All right, this is the top of the application that gets most of the client's demographic information. We need to ask you to please be sure that all of these fields have an answer in them. We will, if we're missing something, we're going to ask you for it. So please provide all the information and accurate information about all of this. Sometimes we'll see that you're not one of the boxes for the CSR or initial review is missing. We'll have to ask you for that. We might need to ask you if the child has a developmental delay or has a developmental disability if you haven't checked one of those boxes. So, and the date of the determination also. So please be sure that all of those are filled in. All right. The information on this page helps us evaluate what's going on. I want to point out the daytime and the nighttime interventions item on the second row up from the bottom. We also have the typical bedtime and typical wake time and typical hours of sleep each night. The department has defined nighttime hours as 9 p.m. to 8 a.m. That's generally our evaluative period. If you have a child who sleeps, their nighttime sleeping at other hours, you can let us know that through filling out this part of the application on the bottom of the client information. But generally speaking, that's how we approach evaluating anything that's happening during the nighttime. Okay, just make sure there's no blanks here as a final reminder. All right, on this slide, you can see I've snipped out the area for daytime and nighttime interventions. And the next step is to fill this in. This is where I had spoken about giving a complete description for daytime and nighttime. And you notice that each of these is the same. The nighttime section also has those check boxes available to you. So all of those opportunities to give information are the same, one for daytime, one for nighttime. The most important part of looking at these 4 columns is that this all applies to the medical condition or behavior. The intervention column is over on the right. I'm going to talk about that separately. And we'll get to that in just a minute. But please know that as you're writing this with the parents, that you're going to describe the medical condition or behavior. The frequency here is how many times the medical condition or behavior occurs. The duration is how long that behavior occurs, and the intensity, and that's a short description of what is the injury to self or others or the consequence of no intervention. So what happens in the case of a medical condition or behavior, and if there's no intervention done, what is the detriment to the child or the situation? All of those apply again to the medical condition or behavior. So as we get to the next part, you'll see when we talk about the intervention, what's needed there, which is the same information, but it's in a different format. We'll get there in just a second. Okay, here's all the details I just described needed for each of these 4 columns in both the nighttime and daytime. So you can reference this. We will have the slides put into a PDF and made available on the department's website. And we will be sending this, I'll send a notice out through our constant contact to you that the information is available to you. So this is what I just described. The medical condition or behavior is a free text field. The frequency, how often it happens, duration, how long each time on average, the intensity, that's the description of the injury. And again, the more information you give us here, and not in volume, but in completeness, the more complete and specific it is, the better it is, and the faster it is for us to do a review, and we may not have to RFI. So now I'm going to go to the intervention column. There is just one column for interventions. So remember, those first four columns all apply to the medical condition or behavior. There's one column for an intervention. What we're looking for in an intervention is the same items that we have for the medical condition or behavior. We want to know what the intervention is, what the person is doing. So you're going to describe what the caregiver is doing that's active, that's hands-on, that's more intense than a verbal reminder or oversight or redirection or monitoring of medical status as well. So the intervention needs to be more intense. That's part of the regulation and part of the application. Remember that. You're also going to tell us how often the intervention occurs and how long it lasts, just like you described the behavior or the medical condition. We need that same information just for the intervention. We know there's just one column for this, so we do suggest that you maybe, if you want to, use a Word document or put it into a PDF and submit it with the application. And you can just make a note in this column that says, see this document for this information. Okay, that helps a lot. I want to point out a couple of interventions that we see or things like this that would not be considered more intense. When you have an intervention that said parent checks on child twice a night, or checking on child, or observation, those are not considered more intense. So you can put those on the form, but they are not qualifying for the criteria for this application. We're looking for those more intense interventions that are going on. So for each intervention, we want a brief description of what the caregiver is doing. We want the frequency, how often, and the duration, how long. And there's one thing I want to say about this part of what you're going to be writing in the application. The goal really is for you to paint a picture of what's needed from the caregiver when the behavior or medical condition occurs. We just need enough information to understand what's going on and what happens that relates to that medical condition and behavior and what's done to intervene. We also know that sometimes interventions are used together. For example, let's say a child is tearing apart a plant in a pot, and the caregiver gives verbal reminders not to do that, or verbal direction, or does verbal redirection. um, that may happen once or twice. Maybe the child moves on to something else, then comes back to the plant. They get verbal direction again. Maybe this time they do not stop tearing apart the plant. The caregiver needs to come over and physically remove the child from that situation and engage them in something else. What we consider to be active, hands-on, engaged intervention is not the verbal reminder, but it is the time when the caregiver is removing the child from the situation and engaging them in something else. So that might be reading a book, that might be playing a game, that might be moving them to another room to do something else with them. So that's kind of the difference between a verbal direction or a monitoring and what's an active, hands-on, engaging intervention. And that's how we look at it. So if you're telling us a story like the one I just told, and there's more than one intervention happening, and you're going back and forth, maybe with a verbal intervention and an active intervention, just lay that all out. Tell us how much time is spent on each of those interventions for that one behavior, so that we can understand how exactly what's happening. You could describe that pretty easily in a short paragraph, and just include the time and how often it happens over a period of time. So over a week or a day. As long as we can understand what's happening, that's exactly what we're looking for. Okay. For medication intervention, please be sure and describe what the caregiver is doing, such as if they're giving a verbal prompt for a child to take a medication, if they're doing medication setup, like in a day of the week setup, and the child is able to take their own medication, tell us that. Or if they're directly administering the medication, be sure and tell us that. So if they're handing the child a cup, if they're giving them some kind of liquid to drink, any of that, just tell us what they're doing. It helps us a lot understanding the needs for the medication portion, if that's one of the things that's happening. So again, we suggest that the case manager uses a separate document to give us the information on the interventions. May be easier for you than trying to fit it into this one column. And we do appreciate any supporting documentation that you have. Again, medical records, letters, therapy notes, all of that can help us understand more about this child, because you're painting a picture for us. So we appreciate any information that would be helpful. In terms of RFIs, a request for information is an RFI, and we do these through the QualiTrack system. So if we're reviewing your case and we need more information, if something is incomplete, if something needs to be clarified, we'll issue an RFI through QualiTrack, and you will get an automated notice from QualiTrack that there was action on your case. You can log into QualiTrack. You can either go through the member hub and find the case there. You can search for the case ID if you know it. Go into the case and scroll down to the bottom, and in the correspondence section, you'll see an RFI. It's highlighted. You can click on it and open that RFI letter, and the RFI letter will describe for you what's needed for each RFI. Note that if there's more than one item needed, we'll number those items and separate them for you so that you can see each item that we need. And when you respond to the RFI, please be sure you're addressing all of those items. The end of the RFIs, which is an important process, is really how to avoid them. Everything that I've said today was really focused on how to help avoid RFIs. Once again, so these are reminders, you've heard me say it. Please complete all the sections of the application. Ensure that each item has a response. Include the details needed to paint a picture for the reviewer. and the reviewer also reads the 100.2 or level of care assessment. They will read all the documentation you provide, and to help understand the need, understand the child, understand the circumstances and conditions of that child, and what's needed in terms of interventions to assist them. So be sure and include all that detail, all those extra bits of information, diagnoses, therapy notes, all of that is helpful to us. Again, those are not required, but they are helpful. Okay. The last thing I just want to say is really there's a lot of benefit to avoiding RFIs. By avoiding RFIs, your case is going to be completed faster. The case managers, you'll be able to reduce the time needed on submissions by handling all those items up front, making sure everything's complete and you've painted the picture for us. And members may be able to access services more quickly if RFIs are avoided. So hopefully that's helpful and a way that we can work together to get these reviews completed and get services to those members. So that's the end of the presentation. I'm going to stop here and ask for questions. Does anybody want to? I have to scroll through chat and see if there are questions, or if Kristen, if you've been watching, you can chime in and let me know, or April. But I wanted to give an opportunity for anybody who might be on the phone to come off mute and ask any questions, or anybody else if you want to ask a verbal question. Now's the time.
I see a couple questions in the chat.
Okay.
Are you able to see them?
Yeah.
Okay.
I'm going to start at the top. Okay. Yes, I can. Thanks, April. Christina, I'm going to hold on that nurse assessor question. We'll catch that on the end. We're going to try to focus on CES now.
I can't.
I'm sorry?
I can't do it.
I'm sorry, you're breaking up on my side. I apologize. I couldn't hear that.
I think that may have been an accidental unmute. I think you're okay to continue,
I got
Pam.
it. Okay, thank you. Okay, good. Okay, and then here's Christina. You're curious if there's been a conversation of requiring the CM include the information that is in the CES application in the 100.2 assessment so that the CM doesn't have to complete duplicate work. Most, if not all of this is in the 100.2 assessment, and so a CM would need to ensure that the frequency, amount of time, etc., is in the narrative. It is an incredibly time-consuming reformat of what is in the 100.2. I might ask the department if they have any thoughts on that they want to share.
Hi, Pam. This is Kidron. I can take that question.
Thank you.
Yeah, absolutely. And I apologize that I am not on camera. My internet completely went out, and so I am on my phone. So sorry you all can't see my face. I try really hard to be on camera, but not today. So Christina, thanks for that question. I want to say a couple of things. So when we're looking at that CES application, we're looking at identifying that those interventions, whether they meet that daily intervention and overnight intervention requirement, that is not specifically called out in the 100.2 assessment and that level of care assessment. And so in order for us to make sure that we have a solid review process right now, that's why we have that CES application and why we have that so detailed on that CES application because we're really trying to capture what those full needs are to justify that the member truly meets those extensive service needs. So right now we don't have a way for that to change. I will say that this CES application and review process is only going to continue until we implement the Colorado single assessment. When we implement the Colorado single assessment, the target criteria review will be within that assessment and we won't have to do this separate application. So while we can't change that right now and we hear that it it's extra work for you all to do, we can say that eventually that extra requirement and documentation will be within that Colorado single assessment specifically.
Okay, thank you, Kidron.
My pleasure.
All
I
right.
see Christina's hand raised. I don't know if she wants to follow up with that since that was her question.
Thanks, Christina. Did you have follow-up?
I do. I'll try to keep it short because I know you have another section to get to here. But so as far as like it not being documented in the 100.2 part of justifying a score or supports needed or due to factors in the 100.2, case managers, at least how I train them to include those interventions, those physical interventions that meeting targeted criteria, because that's what helps justify their scoring. So even though it's not necessarily like, I mean, I'm sure you can appreciate that the comment section is just a paragraph wide open, like you just type things. There's not really a ton of guidance. And so, like, I guess I'm just wondering why it couldn't just be whatever you would put in the CES application, make sure you're putting it in the 100.2. So that way it's just not a separate document that needs to be completed. That's kind of where I'm coming from.
Yeah, thanks, Christina. I appreciate that. And I appreciate the way that you're training your team to do those assessments. I think that's fabulous. I think because we have the CES application as part of this review process, there's not a way for us to have additional resources of just having it in the 100.2, but I really appreciate your feedback, and we really look forward to implementing the Colorado single assessment where we don't have to do the separate application and review process. So I appreciate your feedback though.
Okay, thank you. Kim asked, what if there is a missing Medicaid ID? Kim, I'm not sure if that means missing from the application or missing for the member. Can you clarify? Kim Wallace?
Hi, the question was from Blessing. It was if the member does not have, can you hear me?
Yes.
Okay, it's if the member does not have a Medicaid ID at the time of filling out the CES application, because I've had, members not have.
I don't know when this is starting in the process, but my understanding, and again, the department could pipe in on this and clarify, that they have to qualify for Medicaid functionally before the application before they can get on the CES waiver. So they may have a temporary number. That was my understanding. But Aaron or Kidron, do you have anything else on that?
Glad to take that question. For people that are in going through the initial enrollment, there might be times where they don't have a Medicaid ID quite yet, because we can't right now with the streamlined eligibility and having the CES review separate and apart from the 100.2 assessment. We would need to have that CES target criteria before the case manager submits that level of care through the streamline process. And so if a member doesn't already have Medicaid and they need the long-term care functional eligibility to the county to initiate that Medicaid ID, there may be times when there's not a Medicaid ID for people enrolling in CES. So that is something that you could potentially, Pam. Doesn't happen very often.
Okay. And I would say if they don't have one, I mean, in that case, my guess, based on what I know about the data, is we would not receive a record for them from the member data that Telligen receives from the state. If they don't have an ID yet, highly likely you could search for them by name. But if you manually enter someone in the Qualitrack system, they would get a system generated temporary ID. So we would see that on their member information. But if you just put a note in that says this member has not been issued a state ID yet, that's fine. Better than leaving it blank, because then we'll RFI and ask you for a number. So if you know there is not a number yet in those rare situations, you can just add a note and that'll tell us. Okay. Thanks. Kendall said, I always write NA and that seems to work. Okay, I'll take that. I think letting us know for sure that there's no number is a little bit clearer for us, but I appreciate that you do that. Thank you, Kendall. Okay, Christy asked, I usually upload all documentation to CCM, such as an IEP, a neuropsych, behavior plans. Do the reviewers look at CCM? The reviewers are required to look at the 100.2 right now. And the process has been that the other documentation be attached to and submitted to the case. The challenge is we don't always know who does and doesn't do that, and it takes an amount of time to go looking for information. So this has been the process to date, and for our part, right now, we would appreciate it if you would still attach those to the case you're submitting to Qualitrack. Okay, Anissa said, is there a way the case manager can talk with the reviewer when there is confusion on the RFI? There is a way to talk with you. Typically, I'm the one who's going to talk with the case managers, and I'll consult with the reviewer, and if I need to pull them in, I will. We like to try to keep our reviewers reviewing, and if they spoke to every case manager who had a question, they wouldn't get their reviews done. So I'm kind of the filter for that. But as needed, the best way to do that is to call the support center or put in an email. And if you have RFI specific questions, include them in your request. And I can, if you specifically want a phone call in your request, please ask for a phone call back and I will call you back. When you do that though, please let me know the best time and date to reach you and give me multiple options, because I know how busy you are and I know that you're often out with members. So if you can be really specific about the best way to reach you, I will call you back. Okay. And we'll figure out what your questions are. If it's something I can't answer, then I will pull in a reviewer on that for sure. We do want to make sure that we are available to you. We answer all of our tickets in the support center. We at least get to them the same day, or if at the next day at the latest, to get back to you. If you speak to one of the agents, just tell them if it's urgent for some reason, but just let them know you want to talk to someone on the operations team or on the review team. And I'm usually the one who is going to do that. April may do it if I'm not available, or someone else may do it if I'm not available. But typically that's my job, and I love to talk with you about it. Okay. I'm going to, as soon as I'm done talking here, I'm going to paste in the support center information again for those of you who came in after I did that earlier. Okay. The section on other medical supports is always a challenge, especially as we don't always know when things have started. How detailed do we need to be? Sally, can you tell me more about the section you're talking about?
Sure, yeah. So after the tables, when you get to the bottom, there's
okay. The other documents.
Well, it's like it's a chart that says other Medicaid or state plan services. Yeah.
Yep. I'm going to share, I'm going to stop sharing the slides and I'm going to show the application so everybody can see it. Go ahead, Sally. And you're asking.
Sometimes it specifically asks like how long the medical support has been in existence or how long they've been using it or something like that. And it's a challenge for me to sometimes find that documentation, particularly with the family. And I was just wondering how significantly that section was examined. So
Okay.
not that part, one more down.
This part?
Yes.
Okay. I think the answer to this is, I mean, if you don't know the specifics, you don't know the specifics. If the family doesn't remember, that can happen. Not everybody has all of those dates and medical records in hand. But if it's there, to the best of your ability, you can put in, they know for at least, a couple years, 2 or 3 years. The more specific you are, probably the better. But if you don't have it, you don't have it.
What is that
Um,
information used for?
it's reviewed as part of the application. It tells us more about the child. It doesn't affect the outcome per
Okay.
se. Okay. It just tells us more. Is there anything from Kidron or Aaron that you have to add to that?
I'm so sorry. I took a minute to unmute. Nothing else to add.
It's okay. Can you guys see this? Can you see what I'm sharing? The
Yes.
application? Okay. All right. Just wanted to make sure. Thank you, Joanne. Okay. And Christy added, she usually put TBD. Thank you, Christy. Joanne said, I will put in how often they see the provider. If dates are known, we'll enter when the next appointment is. That's helpful. Thank you, Joanne. I would say it is not a it's not a huge factor for us for the review, but it's information that's helpful to us. Okay. All right. And I wanted to just go back, Sally, to that for other people's reference. I thought you were talking about another piece of the application. Sorry. My apologies. Okay. Sorry, I had a little confusion. I was thinking about the SLS application. That was my brain bubble. My apologies. Okay, I'm going to move on. Brian asked, is co-sleeping considered a behavior line to be considered a behavior line to be considered? I'm going to let the department speak to that, if you would, please.
Sorry, Pam, I was trying to get my
Okay.
computer's internet to work so I could get on my computer where it's a little bit easier to look at the questions. What was the question?
The question is co-sleeping considered a behavior line to be considered?
So good question. Co-sleeping is not an intervention when it's the family's decision to co-sleep. The activity of co-sleeping itself, in order for it to be an intervention, would be that there is a need to have the youth in the same room as the adult during sleep time because supervision was needed, or they needed to provide active interventions throughout the night. But just having a parent saying, I feel more comfortable with the youth co-sleeping with me because that's just how I feel, is not an intervention in of itself. The case manager would need to justify how that is an active intervention, and it's not the act of co-sleeping itself. It's what other interventions are happening overnight.
Thanks, Kidron.
My pleasure.
Okay, Zoe, I don't know which one it is, so forgive me. You can correct me if you want to come off mute. You asked, can you explain why a denial would include resubmission and appeal details 5 business days, and it is not available in Qualitrack? This is a contractual item. There was the ability to do an appeal, which we called a reconsideration in the last contract. In this contract, that is not available for CES. So that had to be clarified earlier on in the as the contract got started, and we worked with the department to clarify that, and the decision was made to not have that 5 business day appeal period for reconsideration. So I appreciate you bringing it up. I understand, and Kendall commented that it's cumbersome to wait for an entirely new submission. Understood and taken. And I'll tell you that there's been some discussion with the department in Telligen as to those possibilities, and ultimately, this is currently the status of an appeal or a resubmission, and we will take that back and have discussion with the department if they would like to about offering that option again. Okay. Next question, is each case reviewed by the same single reviewer after each RFI? Almost all the time, that is what happens. Our reviewers like to do that. We know it makes for their familiarity with the case. If someone's out on PTO or someone is sick and they can't do the review after the RFI, another reviewer will do it. We put a lot of effort into having a brain trust around our reviews. So all of our reviewers are trained the same way, work together, work on questions together with each other. So almost all the time it's done by the same reviewer, the full review. But not all the time. Can't guarantee that that'll happen, but we do try to do that as much as possible. Kalpana, how can we delete the previous referral and submit a new nursing assessment? We are not talking about nursing assessments today, Kalpana. When April's working on her presentation, I will, when she's done, I'll put in the chat a phone number for you to contact the skilled nurse assessor program so that you can work with them on your referrals. Okay. Today, this is for CES and SLS exceptions only. Okay. And Daisy, do you take into account a stabilized condition due to the supports in place, like sleeps through the night due to medication? I'm not sure what you mean with regards to taking it into consideration. If no intervention is needed during the night, then it would not be counted as qualifying because there are no interventions needed. Understanding that the medication is the intervention and it's handling, a non-sleep situation. So no additional interventions are needed. So it would not necessarily contribute to targeting criteria. Kidron, is there anything else on that you have?
I would just say that I agree with that answer, Pam. In order for a member to qualify for that target criteria, they need to have both daytime active interventions and overnight interventions to meet the criteria for this waiver. The target criteria for the CES waiver is helping us qualify members that have those extensive support needs. It's not like the elderly, blind, disabled waiver where you have those lower thresholds of eligibility where they have a diagnosis and they have needs with their activities of daily living. That CES waiver is really only for those members that have those extensive support needs. So just the requirement of having a medication or, the routine at night of the kiddo needing medication before they go to bed, and then they sleep the night, that kiddo is not going to qualify for the CES waiver if there's no interventions. It has to be those interventions have to be needed to qualify.
Okay, thank you, Kidron. I'm going to quickly go through the rest of the questions so we can move on to SLS. I'll let everybody know we have another Q&A planned for SLS. So we will take more questions there. And if needed, I'll stay. Whoever can stay from Telligen or the department can stay at the end of the session to make sure we get as many questions answered as we can, or we'll be sure to get back to you after the session with answers if we have to. Okay. This recording is not going to be published, but from the recording, we produce a Q&A document that will be on the department's website for you, and Karina put that link in there. And Anissa, I saw your comment about letters. I'm not sure what's going on with that. I will make a note to reach out to you so that I can see what you're seeing. RFI letters should always say RFI when they're posted in the correspondence section, and outcome letters should always say outcome when they're posted there. Occasionally, a reviewer might select an outcome letter instead of an RFI letter, or vice versa, because they actually attach it themselves when the review is done. So you might get the wrong type of letter. If that happens, you can call the support center and we'll fix that for you. But I don't think they're labeled incorrectly. It may just be the wrong letter that was selected. Christina, you say you train people to include the specifics if it helps support the interventions and medications that are listed. Oops, my page just jumped. Okay, sorry. On the rest of the app, or if something has subsided due to stabilization and supports, make sure to include the specialist and support. Thanks, Christina. That's great advice. So Amber asked if co-sleeping can be an intervention for elopement. I'm going to ask Kidron to take that one too.
Yeah, absolutely. So again, it goes back to needing to provide documentation and verification of what the active intervention is occurring. If the family says, we know that kiddo might elope, and so we co-sleep. So that's an intervention that's working, that everybody kind of sleeps together and there's no active intervention that disrupts that routine overnight of needing to stay awake and providing supervision overnight. And so that alone would not qualify a member to qualify for the CES waiver. You can certainly document that, and that can be part of an overall picture. But you would need to document. So if the kiddo is known to elope and the family co-sleeps and they have to wake up every hour to make sure kiddo is still there, and that lasts for a period of time, or if the kiddo wakes up frequently and they have to get the kiddo back to bed, and there's other interventions. It's a holistic picture. Okay, so there's never going to be just one intervention and one diagnosis and one explanation and documentation of that intervention that's going to qualify kiddo, that totality. So you can certainly add that on the application. Just know if you're having co-sleeping as the only intervention, like only under very, very extreme circumstances would that be the only thing that qualifies them to access the CES waiver.
Okay, thank you, Kidron.
Yeah.
I'm going to respond to the question about data in the chat, and we can go ahead and move on. April will start talking about CES now. And I'm going to turn it over to you. Thanks, April. Thank you, Kidron, for your help.
My pleasure.
Hi, everyone. My name is April Kelly. I am going to present on SLS exceptions today. So we have about 30 minutes to go over these slides, and then we'll have a period at the end for questions. So we're going to start with the training site. This is a great resource to use, to look at, to find. Anything that you need is going to be located here. We do use this link in our RFIs as well. So anytime you get an RFI for an SLS exception, you will see this link as well. So you're going to find everything you need here to reference or as a resource. So please keep this handy. Similar to CES, we do request that you use the most updated SLS exception review request form. Currently, that version was updated in February of 2025. You will also find that on the link above. And then anytime this has been updated, you will find that on the link as well. It will be anytime. I would recommend not saving this to your desktop or to your own documents. Please always go to the training link for the most updated version of the SLS exception review form. So you're going to submit an SLS exception when the member needs services beyond the established limits of their SPAL or their budget prior to the end of their certification year. SLS exception outcomes expire at the end of the member's certification period. A new request may be submitted at the time of the member CSR if the member's increased needs continue. And we will go to the next slide. So I'm going to briefly kind of touch on the two different types of SLS exception reviews that we have, and then I'm going to pass it off to Karina with the department to kind of talk a little bit more about some changes with the urgent review type. So we have the SLS standard exception review, and then we also have the SLS urgent exception review. So most of the time you are going to be submitting a regular exception. There are a few different instances where an urgent will come into play, and I'm going to, again, let Karina speak on that. For members who already have been approved or partially approved for an SLS exception request, actually, I'm going to stop there, and I'm going to let Karina talk on the urgent and what the new requirements are surrounding the urgent. Karina, if you want to jump in here.
Thanks, April. Happy to do so. Hi again, everyone. As April had mentioned, there are some changes to the SLS exceptions process, so sharing and discussing those with you today. Just a heads up, there will also be a memo coming out in the future to address these changes more formally. So first up on the slide is when case managers can request an additional SLS exception review for the same member. So if a member has a currently approved or partially approved SLS exception already in place, in order to request another SLS exception for the same certification period, there must be a change in condition or circumstance, and that should be reflected in the member's person-centered assessment. We would expect this to look like an unscheduled review label in the CCM. So an actual example of this, a member has an SLS exception that's active. It approves them for additional SCC units. The member then requests to add in additional mentorship units. But in order to do this, there must be some sort of change in condition or that circumstance that kicks off that secondary request within the same certification period. A part of this is that we want to make sure that members' needs are addressed and met related to the criteria. And also we want to avoid any duplication of services and or requests. If there's not a changing condition, then alternatives to an SLS exception will need to be explored. April got into this a little bit. So we now have two types of SLS exception submissions. We have urgent and standard. Standard is what you're already familiar with. So the member meets the criteria, has a need, the SLS exception is requested. Urgent is an exceptional situation that requires approval from the department in order to pursue and submit. These are going to be extraordinarily rare, very unique situations where a member has to have services begin within 5 days of submission. So that keyword is must. The exception is that, or the expectation is that there probably is already some sort of escalation ticket. There's probably some sort of department involvement already occurring in these cases. If we can go to the next slide, we kind of have a nice comparison put together for standard and urgent reviews. So again, I'll go through standard. This is a typical review. There's no department needed. You submit when the need arises. It can't be retro dated. That's not new. But the start date must be dated 6 days or more from the submission date. So the date of submission counts as 1 day. So if it's submitted on the 1st, the earliest it can be dated is the 6th. These reviews can have up to 2 RFIs. Those RFIs are request for information. They do need a response within 10 business days. This is across the board for all SLS exceptions. There are no reconsiderations or reopens. So really, whatever you submit, we really want to try to make sure that all the information, all the questions are answered in that initial submission. Comparing to urgent again, is services have to begin within 5 business days. That prior HCPF approval is required. Again, just reiterating here, it's an unusual, exceptional circumstance, and services have to begin within 5 business days. This also can't be retriated, not new. An exception to the urgent is that there's no RFIs. So it's really critical to have all the documentation submitted correctly, all the information correct. Telligen will not be able to approve if a wrong form is used, or if the calculations are incorrect, or if the information's not clear. So these urgent reviews really do need to be thoroughly and really critically reviewed and completed. I'm going to, oh, one more note, also may not be reopened. I know I mentioned that already, but I'll pass it back to April to kind of get through the rest of our slides, and we'll take questions on these new changes.
Thanks, Karina. And I just wanted to remind the case managers on the call that if you are submitting an urgent, Telligen will be looking for that uploaded approval from the department. If we don't see that, it's going to be an automatic denial. Because urgents don't have the ability to do an RFI, most of the time you're going to see a denial on these if those things are missing. So with urgence, it will either be outcome with a denial or approval or partial approval. So just wanted to remind you guys about that. I think sometimes we've seen some of the case managers submitting as urgent, thinking that means we're going to get to them faster, which is not the case. So I just wanted to remind you guys the difference between standard and urgent there. All right, so I wanted to go over the required documentation for all SLS reviews, also SLS exception reviews. So what we're going to be looking for is the most current SLS exception review form. Again, if we don't see that most current review or most current form, we are going to RFI. We will need to see a copy of the prior authorization from Bridge. So I am going to stop here and let Pam share her screen on what an example of this looks like. We have been noticing that case managers really haven't been submitting this one, and or they're just submitting the service plan. We do need 3 documents are required: the exception form, the PAR screenshot from Bridge, as well as the member's service plan. So I'm going to have Pam share what a Bridge screenshot looks like. We do need this information because it does have the member's SPAL on it, which should match up with what you're reporting on your exception form. And it also shows us all of the different services and units that the member is accessing, which really helps out with the review altogether. We are going to be looking at all of the services on this PAR. We're looking for duplication. We're making sure that there's no, with all of the services going over 24/7 care. So this piece that you're seeing right here, again, this is what we're calling the PAR screenshot, or the PAR. We do need this. We have seen a lot of times that this is not being included. So I really want to focus on this and make sure you guys understand that this is a required form. If we don't see it, it will be RFI'd or denied. The next required piece is the member service plan. Pam's going to go ahead and show that as well. This is another view of all of the member services, the units that have been approved, as well as some other information that we're looking at on here. So just wanted to make sure you guys knew the difference between the service plan and the PAR, and make sure you know that these are both required for any SLS exception that you submit. All right, thank you, Pam. And then, there are going to be times when we do request some other information from you. Sometimes the member might have CDAS or IHSS, something along those lines. If that is the case, we need you to be a little bit more specific with us. So we might see CDAS on your PAR. And we all know that when you see CDAS on the PAR, it does not calculate to how much time that's being provided to the member. So we are going to ask you for a breakdown of what CDAS services are being provided for this member. We want you to tell us how many homemaker hours, how many PCP hours, how many HMA hours, and we will be asking you what tasks are being provided during that time. Again, we're looking for duplication, and Not all of the time does SLS services duplicate with these, but sometimes it does. So please be as specific as possible if your member has CDAS. IHSS is a little bit easier because it does break down the units for us on the PAR, and we usually see a care plan as well from the agency. Another thing that we noticed that a lot of the members have is long-term home health. So if your member does have long-term home health, again, we do need to see very specific information for duplication. So we should see a long-term home health PAR, which usually comes from the agency. If you're unsure, you can always reach out to them and ask. This includes how many units are being provided, what the modalities are, if it's CNA, if it's RN, how often. And then the separate piece to long-term home health is the 485, also known as the care plan. You can also get this information from the long-term home health agency. And this is very helpful for us to see what is being provided. If it's the CNA, if it's the RN, how often they're coming out, and very specific information on what's being done. So we will RFI and ask for that information if the member does have long-term home health. Just so you know, we should see a long-term home health amount on the PAR screenshot. That's usually what triggers us to know if a member has long-term home health. Sometimes some other documentation that you include might trigger us to know as well. And then again, other helpful documentation not required. Right here, some medical records, notes, letters, therapy notes, anything that you think will be helpful for us to help justify the service that you're requesting is going to be very beneficial. So when you go to that training link that Pam again will post in the chat at some point, there is a breakdown of all of the different services that you're able to request under the SLS exceptions. And there is, some good information on what the justifications are for each service. So sometimes, for behavioral services, we will see specific information from a behavioral therapy place. Again, very, very helpful information for us. So usually the more the better. I shouldn't say that. Sometimes, we don't want information that we don't need. So make sure that it's relevant to the case. But it is helpful for us to see and read, hopefully to prevent some RFIs. All right, moving on. So with the SLS exception form, similar to the CES, we do need to see that that form is complete. Every single area on that form, please have a response. We will RFI if we see something blank. So please get as detailed as possible on that form. Please provide clear and complete information. Again, like Karina stated, we can't have any retro dating for services. So keep that in mind when you're filling out the form and the start date, that it cannot be retro dated. We will automatically deny any case that we see that's been retro dated. Math, this is a fun one. So there is some math involved when you're calculating your units, calculating start and end dates, and rates. So you will have to take your rate and multiply it by your units to get a certain amount for the increased SPAL budget that you're requesting. We have seen a lot of the times that the math is not correct, and we will RFI for that. So please just make sure that you're using the most up-to-date rates, which again are also available on the HCBS website. They just changed 15 days ago. So there is an updated version that's 10.1 for rates. So again, please make sure you're using the most current rates, and double check that you're using the correct modifiers for your services. So for example, if it's Denver County or not Denver County, we want to make sure that those are different rates. So make sure that your math is correct with units, rates, and the SPAL budget amount. Please take some extra time for this. I know it's complicated. I know you guys are not mathematicians, and we're not either. So just try to make it as clear as possible for us if you can. Really helpful. This is another important one. Make sure that your service request aligns with the service definitions. So again, that link that we provided, Pam again will put it in the chat. It's the training site at HCBS for SLS. each service has a definition, and when you're requesting it, it's going to ask specific things. It's going to look for goals. It's going to look for, very, very specific things. And there's also certain things that maybe the member is under 21 and, they might be required to receive some of these services through a school prior to you requesting the service. So please take a look at those service definitions before you request the service and make sure that it aligns with what you're requesting. And please make sure that you're as detailed as possible as why this is needed. It's very, very helpful. Let's see here. Okay, and just reiterating what Karina said about the if you're requesting more than one review in a member certification period, please make sure that we need to see that there was a change in condition for this member. And to see that, you can let us know what the change in condition is, but we're also looking for a unscheduled review in CCM at this time. So if we don't see that, and the member's already been approved for services within their certification period, we will be RFIing and or denying the case. So just a reminder there. All right, another reminder to check your math. Again, this is probably one of the #1 RFIs we see. So we're just duplicating it for you just to really hone in that we really need to see the appropriate math, appropriate rates, all those things. Another big reason for RFIs is missing documentation. So that's why we went over the PAR screenshot and the service plan and using the most recent exception form. With the standard reviews, you will get up to 2 RFIs followed by an outcome. And again, just a reminder that if you're submitting an urgent, there are no RFIs for urgent. So you will see an outcome, either an approval or a denial. Just a reminder there. And then on this last slide, Pam is going to be putting some links in the chat for you. Please get familiar with these. These are going to be your most helpful tools when submitting for an SLS exception review. So on the site, you're going to have everything that we've discussed today. Everything you need is here. And then there's also a webinar training. So if you really feel like, you're in the dark or this didn't make sense, this is a really helpful tool to get in there and understand what these are for and help you to submit a review that maybe doesn't need any RFIs. All right, we will move on to, let's see here, includes resources. So again, we're putting in the HCBS training site. If you're new case manager, this will kind of walk you through how to register for QualiTrack if you haven't done that yet. It'll give you kind of an overview of QualiTrack and how it works and how to upload and all of those things. And then on this link that Pam has, you'll also have the provider manual for CES and SLS, which will also kind of talk about everything that we went over today. You'll also see on this link any memos or guidance from HCBS. This is a good place to check regularly, just in case there are some additional memos or changes that have come up. It's a good place to always visit and see what's available. Pam has included the Telligen Support Center for you. Anything that comes up that you might have a question on, you want to ask a specific reviewer, a specific question to an RFI or denial, you can either call and or send an email with your questions. And then we have Karina's information. She is the benefit specialist and SLS exceptions person to contact at HCBS. So here's her contact information if you ever need to reach her. Helpful information, and we will stop there and pause for some questions. I do see quite a few in the chat. Before we do that, I'll give it a minute to see if anybody wants to come off mute and ask their question with their mic off, or we'll do that first before we get to the questions in the chat.
I also wanted to add, April, that Karina, we had an item on there for feedback on the form. And I think Karina had mentioned to us, that if anybody here has feedback on using the form. Karina, do you want to talk about that at all?
Yeah, happy to do so. I will first address Liliana's comment. I'll read it out loud for folks that may not be able to see the chat. So is there a way to include directions regarding the 3 documents? Example, saying service plan makes me think I need to grab information from the CCM, but you showed the bridge cover sheet. SP format from the bridge. I think information can be pulled from many different places. So if we need a bridge screenshot for the PAR and the bridge cover sheet or SP, I think that will be helpful. Liliana, that's super helpful information. So currently what we have on the form is a copy of the member service plan and the prior authorization record. We can certainly update that to include like bridge cover sheet would apply to the service plan, and then the bridge screenshot for the PAR. And as Pam had mentioned, would also love to hear from you if there's anything on the form that could be clarified or anything that's confusing for you. We'd love to hear how we can improve that to make it accessible for you too.
Okay.
All right, I'll
Thank you,
start
Karina.
with, it looks like we had some questions that were answered by Karina and Kidron in the chat. So I'm going to go ahead and leave those there. Please read at your leisure. And I'll start with Lilia. Is there a way to include directions regarding the 3 documents? Example, saying service plan makes me think I need to grab information from the CCM, but you showed the bridge cover sheet service plan format from the bridge. I think information can be pulled from many different places. So if we need a bridge screenshot for the PAR plus the bridge cover sheet service plan, I think that would be helpful. Yeah, thank you for that question. Yeah, the examples that we showed today are the versions that we need. So yes, I know service plan can mean multiple different things. PAR can mean many different things. So that's why we wanted to show you guys the examples today, because there are multiple uses for that wording. So the way we label them is service plan and bridge PAR or bridge screenshot. So yes, if you're calling it the cover sheet service plan, yes, that is what we need. Hopefully that answers your question. As far as units, looks like Karina answered that one. Scrolling down here to see if there's anything. Okay, please post the provider rate link 10.1. Looks like someone posted that for us. That's also available on the HCBS website. So please visit that frequently if you need the most updated version. And I am down to the end. Thank you, Karina, for answering those questions in the chat. Does anybody have any other questions regarding SLS exception reviews? Please feel free to post in the chat and or come off mute.
I would also offer, if you have anything else for CES, you're welcome to ask that now too. And Kidron, you have your hand up.
I do, and it's related to, I just want to circle back to CES and something that I think would be really beneficial for everybody on the call to hear today. Case management agencies and case managers, one of the tools that the department really counts on you to use as you're doing service planning for members that are wanting to apply for any of the children's waivers, and you're looking at approving services for youth, we want in everyone's toolbox that age appropriate guidelines document to be used. That will give you also a huge advantage when you are completing the person-centered service planning process, to have that age appropriate guidelines in your toolbox. One of the things that we do see on CES applications are interventions listed as things that would be otherwise age appropriate for a member, or for intervention to be happening between a parent and a child. So just want to make sure that you are consistently using that and comparing that when you are filling out those interventions. Because on the reviewer side, we're also having Telligen review that target criteria from that understanding that there are certain things within those age appropriate guidelines that maybe listed it as an intervention, but we have to compare that to those age appropriate guidelines and make sure that the interventions that are listed aren't something that's of a typical nature that would occur between a parent and child relationship. So that was just a shameless plug, Pam, to make sure that everybody, that is something that's posted on the website. It's posted on our case management tools page. Just really hope every case manager has that readily available.
Is there a way for me just to piggyback on that real quick?
Sure.
I'm just wondering, as we're looking at those age appropriate guidelines, I know, like, just as an example, under I think 11 to 14 years old, if I can remember correctly, it says that it typically takes about 15 minutes for that individual to clean the floor. And if we're doing the level of care and the parent's like, no, it actually takes me 30 minutes to clean the floor because this, and this. Is that okay as long as we clearly document why it's taking them much longer than what the norms would indicate?
So Amanda, thank you so much for that question, because that's exactly why we want case managers to have that tool, because they need to be able to identify like what's the age, like the typical time for that activity and typical expectation for a youth that age. And your thought process is exactly on point. If the parent is saying, you know, the age appropriate guidelines say that activity should take 15 minutes. If the parent is like, my 11 to 14-year-old cannot, like, there's a legitimate reason why they cannot clean the floor themselves. They have a physical disability that keeps them from doing that, or that because of A, B, and C, it takes longer. You're exactly right. Your job is to document that differentiation of what the typical age appropriate guideline for that is, and document what that differentiation is and why. And you can do that within the 100.2, and you can do that like if it's for CES intervention. But as you're specifically looking at justifying those services that you're authorizing, you're right on point. That's exactly what we need you to do.
Thank you so much. That's so helpful. I appreciate that.
Yeah, thanks for the question.
All right, any other questions, CES or SLS, or comments? Any other input from the department? Anything anybody wants to say? Now's the time. I posted all of the links that April talked about a couple of times in the chat, so take a moment before you leave the meeting to scroll back up into the chat if you need those SLS, if you need the link to the SLS form or the training video. I rewatched the training video recently and I still found it really helpful, even though we've been doing this for some time. So I definitely suggest doing that. Karina does a great job on that training video. Karina, you have your hand up.
Oh, thanks, Pam. I just wanted to do a shout out to everyone attending today and say thank you so much. I know that you're all busy. I know that schedules are busy. I know there's a lot of changes happening. So thanks so much for making time and being here today. And we obviously have this to support you. We want you to have successful CES applications. We want you to have successful SLS exception applications. So per the usual, we'll be hosting something like this quarterly. If there's topics, please let us know. We're always available for questions. Pam mentioned anything related to SLS exceptions. There's a training. If you have questions on that, I'm available. Please don't hesitate to reach out. We're here to support you in the success, which we know equals a success of members. So thank you all. Appreciate you so much.
Thank you, Karina.
Maybe I should also just say it is, we're celebrating Case Management Week this week. So just a huge shout out to everybody that is in this ecosystem of case management. We appreciate everybody on the call and the teams that may be doing the work in the field and they couldn't attend the call today. So huge shout out to everybody and thank you for everything you do to support members every day. Happy Case Management Week.
Yes, thank you. Thank you, Kidron, for mentioning that. And from our side, we appreciate working with all of you and all the hard work you do. We know both at the department and Telligen, there are people who are former case managers, so we're all well aware of what you do and appreciate it a great deal. So happy Case Management Week. We appreciate you. Just a reminder, if you need help, make sure you call or put in an email to our support center. Again, if you need a call back from me, just let them know that, and I will get back to you as soon as I can. Be sure and give me times and dates that are the best way to reach you, because we often play phone tag, but I'll stick with it and try to make sure that we get back in touch. Okay, we want to make sure that you have what you need to be successful, and it helps all of us all around. So thank you all for being here. We're going to stay on the line here. We have a couple more minutes left in our session, but if there are more questions, we're happy to stay and talk with you and answer any other questions. And thanks so much for being here, and we will see you next time.
Can I just ask one more question about
You
the
bet.
age-appropriate norms? So
Absolutely.
thank you. So under the age of 5, it's rare to find that even within the age-appropriate norms that we would expect a child under the age of 5 to do those things, cleaning their floor, doing their laundry. How do we rectify that within the level of care, and as we're speaking with the parents about that?
Such a good question, Amanda. So you can use that age-appropriate guideline document that's the department has put out for case managers to use as a tool during the person-centered service planning process. If it is on that age-appropriate guideline that it's not typical for a youth to do that activity, then it doesn't make sense that we would pay a caregiver to do that activity for them, because age appropriate guideline says that a parent is doing that already. And so you can use that in your conversation with the family to say, yes, you may have to clean the floors for your 4-year-old, but regardless of a disability or a specific support that a child needs because of a diagnosis or their cognitive deficit, etc., like, regardless of that, it's not typical for a 5-year-old to do that. It's typical for the parent to do it. We can't justify paying a caregiver to do that activity. So it is not something that we would expect case managers to authorize those services if it is not indicated on that age appropriate guidelines that it's something that they should and are expected to do. And therefore, if they can't, that a caregiver would get paid for that.
There's a
Does that
follow-up
help?
question there, Kidron, in the chat.
Sure.
What if it is above
So
and beyond twice what you would do with a typical child?
So also a great question, Sally. Again, your starting point is going to that age appropriate guideline, finding the age, finding the activity, and saying, is this something that a kiddo would normally do for themselves and they can't, and a caregiver has to do for them? If you can't correlate that, then despite how much time it would take, it's still the parent's responsibility to do that. And we wouldn't anticipate seeing services authorized for those activities. You are so
Thanks,
welcome.
Kidron.
Great questions. Now,
Yes.
can I put that like concisely in a Q&A? I don't know. We are really trying.
We'll work on that.
We'll work on that. Yeah.
We will produce a Q&A of the questions and answers here. It'll cover the material that was in the slides. It'll also cover the questions that you've asked in the chat or verbally. So watch for that. It'll come out in a couple weeks. We'll post it to the department's website, and we'll send out an email via constant contact to you to let you know that it's there.
Thanks, Pam.
Sure. Any other questions from anyone? We just hopped over the top of the hour, but if there's more questions, we'll try to answer them. I see people dropping off, but if you're still here, you have any other questions, we can take a few more minutes and answer them for you. And if not, thank you for being here. I see people leaving. Bye. Thank you so much, and we'll see you next time. we'll just sit here and wait for another minute in case somebody has a thought or a question or a situation you want to talk about.
Thanks, Pam.
You
I'll
bet. Thank
stay
you,
as long
Kidron.
as, yeah, I'll stay as long as
Okay.
we have folks here too.
Okay.
So we won't
Thank
bail
you.
on you.
Thank you. Thank you. It looks like most people are leaving.
Hey,
So
Kidron.
maybe we got it handled. There you go.
Sorry. Hey, Kidron, it's Laura.
Oh.
All right, so I'm going to piggyback off Amanda's question on hours because I've heard a couple different things lately. I have not looked at the updated guide, so I will own that in front of this audience as well. But the question came about how we're allotting minutes for tasks. So if the guide says that, typically we're expecting this task to take 10 minutes, but it takes for our member 20 minutes, are we allotting a total of 30 minutes because it's the typical time plus, or do we just allot the additional time it takes?
You want to initiate the total time. So that's a good question. So the total time, it's not the typical time plus. You need to say like, what is the justification for the entire period?
Okay. I think
Does that help?
helps. Yes,
Okay.
because I think we've been doing a lot of complicated math. And as someone said earlier, that is not our greatest skill. So that's helpful. And Amanda asked it just differently, but we take the entirety of it, describe it, explain it, and give them credit for the entire time it takes as long as it's justified. Okay, thank you.
Yes. Yep. As long as it's not, if it's something that is under that age appropriate guideline that this kiddo should be expected to do this activity
Right.
because of their disability or why they're applying for the waiver, they can't do it themselves and we need to justify paying the caregiver for that. You're asking the caregiver how long the total time it takes to do that activity, and it would be appropriate to authorize those services. It's where I will give you an example. We as a state have seen things like 2 hours of homemaker services for a 2-year-old, or like even more than 2 hours a day of homemaker for a 2-year-old. There can't, like, a 2-year-old, any parent should be expected to do homemaking for a 2-year-old. No 2-year-old is going to do their own cleaning and laundry and things like that, right? So that's what we're trying to get, like, those are the issues that we're trying to get at.
Yeah. Okay. That's helpful. Thank you.
Yeah. Good questions.
Okay. It's 5 after. Anyone else? Okay. I think most of the people here are Telligen and the department. Few others. If anybody else has another question, Daniel, Joseph, UV, any questions? Okay. Hearing none, I think we're good.
Thanks,
We'll
guys.
call it a day. Thank you all.
Thanks all. Appreciate it.
Thanks,
Thank
everyone.
you.
Bye.
Thank you very much.
Bye.
Bye.